Good afternoon, and thank you all for joining us here today for an important announcement. I'd like to recognize some colleagues from the House of Assembly and the ministers here to support today. People in Newfoundland and Labrador, like people everywhere, want to lead healthy lives, knowing, of course, that they have access to quality health care when they need it. It's a pillar of our universal health care system in Canada, and frankly, part of what it means to be Canadian. I've seen the problems within our system firsthand for years. Working alongside dedicated healthcare professionals, I've heard their frustrations and seen the toll long hours have taken on their faces and the limitation of resources. So I continue to focus on bettering our broken system. And I am proud of the plan our government has to improve healthcare for all Newfoundlanders and Labradorians. I created Health Accord NL to reimagine our healthcare system, to recommend ways to best deliver services to meet your demands in your communities, to match the modern Newfoundland and Labrador. Health Accord NL looked at how physicians and other healthcare professionals work together to meet the province's healthcare needs, both in hospitals and community settings. After all, we know things have changed. The workplace has changed. Healthcare professionals are not working in the old traditional ways. The time of hanging up a shingle in a small community and caring for people from cradle to grave, 24 hours a day, 7 days a week, is simply antiquated and a romantic notion. And government, as a government, we need to be there to support those professionals in that changing paradigm in a way that makes sense to provider and patient alike. Our government has a suite of initiatives and financial incentives to help improve healthcare based on engagement with stakeholders. And they include a heavy focus on recruiting and retaining healthcare professionals here in our province, like a new $25,000 retention bonus for family physicians, and an extra $200,000 that is helping us hire doctors in hard-to-fill areas and more remote areas, like Bonavista, which I'm proud to say is already working. Today, we have signed 2 new doctors in just 1 week for Bonavista. In all of this, we know team-based care is the best for patients and for providers alike. And we know working in teams is better for everybody. It's an essential feature of an effective and sustainable healthcare system, a modern system to meet the demands of a modern Newfoundland and Labrador. In keeping with the primary healthcare care transformation, Health Accord NL recommended we have been expanding family care teams, like the one here in Pippi Place, throughout Newfoundland and Labrador. A family care team consists of different healthcare professionals working collaboratively to best meet the needs of patients and their families. They generally include family physicians, nurse practitioners, nurses, pharmacists, social workers, and other allied health professionals. There are currently 8 of these teams in various stages of implementation throughout our province, with a goal of having to implement 35 in the next 3 years. Today, I'm excited to announce that with $21.2 million in Budget 2023, we will add another 10 family care teams this year, connecting up to 80,000 patients when fully implemented. This is a significant step forward for primary care across Newfoundland and Labrador, one our government is proud to make. Now, based on a needs assessment and availability of resources to support the team model, these will be established in a few areas immediately, or in the next year. Bonavista, Brookfield, Centreville, Clarenville, Conception Bay North, Gander, Falls-Windsor, Humber Valley, White Bay, Labrador West, Basques, and St. John's. On top of the 10 new clinics, I'm very pleased to reveal the new logo and name for these family care teams. Until now, there have been multiple different names that we've all used. Collaborative team clinics, collaborative care clinics. But as you can see, that's a mouthful. But today we are officially launching them as family care teams, because they are all about providing quality primary health care for you and your family. These teams are a very important component of our plan to improve access to primary care health services for the people of Newfoundland and Labrador. It's part of our larger plan that is built on the Health Accord and recognizes global healthcare shortages following the pandemic and addresses short-term needs while creating long-term, sustainable change. Thank you very much for attending today, and I'll now invite Minister Osborne up for a few brief comments. Thank you.
Thank you, Premier, and thank you, everybody, for joining us today. Our government remains focused on the continuous improvement of our healthcare system in conjunction with our stakeholders that supports our health workforce and better health outcomes for residents of Newfoundland and Labrador. We have several areas that are first and foremost on our radar right now: recruitment and retention, better virtual care, improved emergency services, and the creation of family care teams like the one we are standing in today. We've already taken significant actions to address the current challenges associated with access to care, and today's announcement of 10 new teams for the province further advances our efforts. It was very encouraging that when we received the recommendations from the Health Accord, a number of the 59 recommendations included were already underway to improve healthcare services, including the implementation of family care team models to primary care. As the Premier indicated, we know firsthand that team-based care is best for patients. Students are being trained to work in interdisciplinary teams, and we know that working in teams provides greater satisfaction. We also recognize that the recruitment and retention of physicians and other healthcare professionals are ongoing issues, not only in Newfoundland and Labrador, not only in Canada, but around the world. The situation here in Newfoundland and Labrador is no different. We've implemented and continue to implement a number of measures to attract and retain healthcare professionals to work in our province, including those who will staff family care teams. Family physicians are an integral part of the province's healthcare system. It is important that as we continue our efforts to recruit physicians in our province, that we must retain those who continue to provide valuable care to the residents of Newfoundland and Labrador. Family physicians in Newfoundland and Labrador are now eligible for a $25,000 recognition and retention bonus for a one-year return in service. We've announced this week as well the rural retention bonus, and as the Premier announced earlier, the $200,000 incentive is showing progress. We will continue to work closely with regional health authorities on how to best address recruitment and retention issues, and we will continue to work collaboratively with stakeholders to provide adequate health services to the people of the province. While it is difficult to feel the immediate impact resulting from these initiatives, significant change takes time and solutions are complex, but it is all part of a larger plan. The 10 family care teams that we've introduced today are an integral part of that plan. I now invite Minister Cody to make some remarks.
Good afternoon, everyone. I want to first thank the Premier and the Minister for their knowledge, their strength, and their leadership. This has been an incredible amount of work that you've done, and I appreciate, and I think the people of the province appreciate all that you've done, and all that you are doing. And I also think I want to thank all the healthcare providers for all their emphasis and hard work in ensuring the best health for the people of the province of Newfoundland and Labrador. And of course, we appreciate the direction and guidance that we've received from the Health Accord and all the work and effort that has gone into laying out, I think, a good direction for health as we move forward. Your health is the priority of this government. The strategic priorities of access, of recruitment and retention, of transformation, all form part of that stronger health care that we're all working towards. Today's announcement is a significant one regarding availability. It means that Conception Bay North, Clarenville, Bonavista, Gander, Grand Falls-Windsor, Brookfield, Centreville area, Humber Valley, White Bay, Port of Basques, Labrador West, and here in St. John's will have increased access to primary care. And that's something that we should all be very glad to hear announced today. The funding of more than $21 million in the upcoming budget for these 10 new family care teams is an example of how we are committed to the healthcare needs of Newfoundland and Labrador. And as the Premier said, there will be more emphasis on family care teams as we move forward. Next week, or later this week, just on March 23rd, we will have our budget. It's coming so quickly, days are cascading. But we'll have our new budget. And, you know, I think what you're hearing is your health is the priority of our government. Your physical, your mental, your fiscal, and your economic health. You'll hear more about this on Thursday when we present the new budget. I'm going to turn it over to Melissa Koch of Eastern Health to say a few words.
Thank you, Minister Cody. Good morning, or good afternoon. On behalf of Eastern Health, I want to thank you for allowing us to be a part of this important announcement today. As the Premier and Minister Osborne have said, team-based care provides high-quality care for the patients that we serve. The evidence is overwhelming that healthcare professionals have higher levels of job satisfaction as part of a team, and we are able to successfully recruit and retain them in a team-based environment. At Eastern Health, we have successfully built several teams in both urban and rural communities. Providing care to over 12,000 patients, our teams are reimagining how we provide wraparound care to the people that we serve. And I can say I'm incredibly proud of the work they do. Some of them are here today, and I thank them for their service. Some examples of this innovation include pharmacists working to full scope and utilizing virtual care to offer hypertension programming, improving chronic disease management for patients. Respiratory therapists working in the community, providing evidence-based programming for patients living with COPD and improving their quality of life. Physiotherapists and occupational therapists working with the broad community team to screen all patients over 65 years of age for risk of frailty and intervening early to allow seniors to age in place at home. Social workers helping patients navigate the system as envisioned in Health Accord NL. Registered nurses, licensed practical nurses, dietitians preventing and managing chronic disease, and completing comprehensive intakes, ensuring we can integrate the social determinants of health in the care we provide. Physicians and nurse practitioners working side by side, providing quality care and leaning on each other for their expertise, utilizing virtual care to improve access and patient and provider satisfaction. At Eastern Health and what will soon be the Provincial Health Authority, we are excited to be a part of the system transformation and rebalancing of the healthcare system to a community-based model of care. I will now pass it over to one of our physician champions, Dr. Keating Power, to share her experience.
Thank you so much, Melissa. On behalf of the family care teams, I would like to thank you for allowing our teams to be part of this announcement today. I have spent the majority of my career in the fee-for-service system. For 12 years, I worked in a great clinic with some amazing staff, colleagues, and patients. Quickly, however, the burden of running a business and a full-time family practice clinic took its toll on myself and my family. In 2019, I joined the COVID clinic, and it honestly changed my life. I was months away from closing my fee-for-service practice and leaving medicine altogether when the pandemic struck. The COVID response team opened my eyes to collaborative team healthcare, and it reignited my passion for medicine, and I have honestly never looked back. Today, I'm a proud member of the Eastern Family Care Team. Our team consists of a clinic manager, administrative staff, family doctors, nurses, and nurse practitioners, as well as other allied healthcare professionals. We work together to deliver collaborative healthcare environment to patients. Our team is rooted in respect, compassion, and teamwork. Together, we engage and empower our patients and each other through a journey of wellness and meaningful purpose. We are focused on meeting people where they are in their healthcare journey and surrounding them with the support team they need. We are always challenging ourselves to understand why what matters now. And by doing this, our team is constantly evolving and exploring quality improvement changes. By being active learners and opening our doors to underserviced populations, we are decreasing the burden on the healthcare system, improving healthcare outcomes, and increasing access to quality healthcare. By working with our peer support programs such as the ANC, Doorways, and the Harm Reduction Team, we are providing patients with a place of emotional safety and the opportunity to achieve physical well-being. I believe building a system centered on primary healthcare provider voices, patient awareness, and equality will lead to patient wellness and ultimately to long-term healthcare sustainability in this province. Thank you.
It's about 80,000. That's what we're anticipating. Yeah.
So the clinics have been up and running for a couple of years now. Will you say they're a success, or they're changing healthcare in Newfoundland and Labrador, and how do you measure that?
Well, you don't have to take my word for the fact that they're a success. You heard from a practitioner here who says that they're a success. Everyone I've talked to, patient or provider alike, who's attached to one of these teams, says it's a success. It frankly stems from the way we're training people. People in medical school now are trained to work in teams. They're trained to come out and be adjacent and collaborative to allied health professionals, nurses, nurse practitioners. So this makes a whole lot of sense from an education and a structural perspective. But most importantly, hearing from patients who have attended these clinics, they feel like they're being looked after and they feel like they have access. From a provider perspective, you know that it's a win-win on both sides. The provider knows that the patient's going to be looked after. So if they want to take 3 weeks of vacation or 2 weeks of vacation, they can go do so knowing that that someone is going to look after their patient. The traditional way to practice is to try to find a locum if you can, and that often isn't possible, so you have to shut down. Meanwhile, while you're shutting down, you're still paying your secretary, you're still paying for snow clearing, for telephones, all the rest of it. It's running a business. This allows for the provider to have a work-life balance while doing what they're trained to do, which is look after Newfoundlanders and Labradorians. Equally, the patient knows that they're always going to be looked after. They know that they may not always see the family doctor, but they don't always need to see a family doctor. They may need to see a nurse practitioner. They may need to see a physiotherapist. And working in a team allows for that to happen. They know the patient knows they'll always be looked after. The provider knows the patient will always be looked after, and it's a win-win on both sides.
One of the measures of success must be access to care.
Yeah.
And the Medical Association says that the number of orphan patients has grown to 136,000. So
Yeah, so this is a solution to help address that. There's difference in some of the, and look, I'm not going to debate the validity or the variance within the numbers. Our goal is to ensure that all Newfoundlanders and every Newfoundlander and Labradorian has access to primary care. This is a model that will help address the disconnect between patient and primary care.
Can you speak a bit to the locations for the 10 new family care teams?
Sure, they were chosen on I guess based on a variety of measures, including access to resources, availability of healthcare professionals, and infrastructure. So these first, as you noticed, we said that we're going to roll out eventually. We think we can capture the whole province with 35. So we will continue to build on the 10, and then ultimately get to 35. But these were seen as areas of need and areas that had a basic level of resources that could meet the needs in a timely fashion.
How will staff for the clinics be determined? Can you talk about that?
Yeah, so there's a hiring process involved. It's different depending on the different healthcare professional, obviously. And we're still in conversations with the NLMA about how to onboard physicians, moving away from the traditional fee-for-service model to a different model. And stay tuned later this week. That's all I can say about that. But there will be a different hiring process than would be traditional in a hang your shingle and start your clinic model that has been traditional in Newfoundland and Labrador for 75 years.
Could there be some people who would maybe, lose their family doctor and move to
No. That's not the intention. The intention is to work collaboratively with the NLMA to onboard physicians with a certain patient roster and to leave no one behind in the all-encompassing team model.
How many new staff do you need for these new clinics to work?
I'm not sure the exact numbers. I'll defer to Minister Osborne.
So the clinics will staff up. They'll consist of physicians, nurse practitioners, nurses, in some cases social workers and mental health and addiction staff. Currently we have 8 clinics that are, some are fully up and running, others we're continuing to staff up. These additional 10 will continue to staff up until they're fully complemented as well. It depends on the location. One size doesn't fit all, so one location will have a different staff complement than another.
Do you have a sense of how many FTE you need for all of them combined, coming up with the next these 10?
Do you have that answer?
I was just doing the math. I think a good estimate would be 100 to 120, and then depends on the needs of the community.
But that's all health, that's all comers, that's not 125 family doctors, for example. That includes administrative assistants, and I think the minister just glossed over something that's really important to reflect on, and that is the feedback that we've heard, the feedback the Health Accord heard was that it's not a cookie-cutter approach, that a family team clinic should look differently to meet the needs of the communities. We know that St. John's is not the same as Lab West, is not the same as Goose Bay, is not the same as Port aux Basques, and therefore we need the flexibility to work with the stakeholder to ensure that the teams meet the needs of the communities and they won't be facsimiles of each other along the way.
You mentioned that 2 new doctors have been recruited for Bonavista. Can you just speak to how that process is going and sort of the interest you've seen since you've introduced these new incentives?
Yeah, so we've seen great interest along the way with the different incentive programs that we have rolled out over the last 6 to 8 months. This last round of incentives for difficult places to fill in remote areas like Bonavista has certainly borne some and has created some significant interest, certainly more than 10 people, I believe, interested, but 2 committed immediately, and we're hoping that we can have a full complement to service the emergency department and the new family care team clinic for Bonavista. Because when you create primary care spots, it takes some of the burden off the emergency room as well. When there's no primary care, you need to go to the emergency department or the urgent care center to get your blood pressure checked, to get your cholesterol checked, to get your medications refilled. Introducing a family care team in a community will help eliminate some of that burden and allow the emergency department to do what it's supposed to do while enabling the team to accomplish what it's supposed to do.
This might just be me coming in at the sort of end of this. I wasn't here when you
Sure.
announced, but I got the sense when I was like signing up for these myself that these were like more like temporary measures. Like
No. This is a transformational shift, a paradigm shift in the way that we deliver primary care. I firmly believe, and I've said this in every community around the province, the traditional way of practicing family medicine, although we won't stop someone from doing it, of course, but that's not the way, that's a romantic notion oftentimes where, you know, a Dr. Olds in Fogo, for example, in Twillingate would go and set up shop, hang out a shingle, and see everybody cradle to grave, 24 hours a day, 7 days a week. You know, Sunday in the middle of dinner, there's a stroke victim on his table. You know, Saturday morning during his child's hockey game, there's a broken ankle. Like we have to respect the professional work-life balance that healthcare providers need and deserve right now, and changing the way that primary care is practiced through these teams will enable that, while providing better care, by the way. Because you can imagine if the principal provider is stressed and strained and exhausted, you're not going to get the care that you deserve. So creating a team of support around the patient and providers alike will enable a sustainable model of care long-term in communities.
We've seen a case where you're basically robbing Peter to pay Paul, but doctors are giving up their own patients to go to this. Do you think the pace of recruitment will keep up with the demand?
We're confident that the basic recruitment will keep up. It's not really robbing Peter to play Paul, though. I mean, that's just that would be an exclusive snapshot in time, and looking just at a thin component of a complex problem. We are increasing training, for example, in the medical school. We've increased by 10 to 15 seats. We've increased the complement of nurses and nurse practitioners by 25%, advanced care paramedics by 20 to 25%. So we are training more to fill the changing paradigm that this will ultimately create. But it has to occur parallel. To do it in sequence would be wrong, in my opinion. And then you build a model, and you don't have the trainees. You have the trainees. You don't have the model. You have to be doing them together in parallel, and that's what the Health Accord helped us establish as a strategy, and it's one that I think the providers and patients alike will ultimately benefit from in the medium term.
Does that mean that you're expecting to phase out the fee structure completely?
There will be changes to the fee structure, but that's ongoing conversations between the NLMA and Minister Osborne, and as I suggested earlier, stay tuned for updates in the not-too-distant future.
Is that blended capitation?
That's certainly the model that's being discussed, and you heard today, of course, from a primary care provider today that the fee-for-service model doesn't work. It doesn't work for everybody. I shouldn't say it doesn't work. It doesn't work for everybody. So we need to provide optionality for physicians to achieve that work-life balance. Because right now, of course, you get paid to see a patient. That's how it works. You come in, I see you, I get to bill MCP for the visit with you, not the amount of time with you, the visit with you. That could be a quick blood pressure renewal, medication renewal, or it could be a complex new diagnosis of dementia and Alzheimer's with, by the way, all the subsequent issues that come with that, mobility issues, or a new diagnosis of Parkinson's, which could take an hour. Looking at different models of remuneration to reflect the complexity of care is important for the patient and the provider alike, and will allow for a more fulsome, wholesome provision of care.
For some patients, this is probably a better way to phrase my earlier question.
Sure.
For some patients who go to a clinic now, they just see a doctor. Will they now see maybe that clinic transform to include other health professionals?
That's right. Yeah. Depending, we would never force a doctor to roster to a clinic, but the opportunity and the incentive will be there for them to do so. For that patient, just say you're currently you're rostered to Dr. Osborne. You just got a promotion, Tom. We wouldn't force Tom to then join the family care team. But if he did, then you would have access to all the allied health professionals and support that were within that team, which is why I think that's an incentive enough, as you've heard, for people to join the clinic in and of itself, irrespective of the changing remuneration model.
You spoke to, I guess, the current clinics.
It's hard to see who's talking. I was looking at Andrea there.
That weren't, I guess, fully staffed at this point. Do you have like a time, or like, are you able to speak to, I guess, the level of staffing that's still required at the current clinic before adding these 10?
That's probably best for Minister Osborne.
Actually,
Oh, there you go. He's gonna defer.
it's more of an operational issue. Come on.
Yeah.
So it depends on the clinic, but most clinics have a core team right now, which includes nurse practitioners, physicians, administrative staff, nursing staff. And so we will be building the allied health teams in our 4 existing clinics right now. One is fully operational. The other 2 will have to build the allied health teams, and then the third is actually about 3/4 way done.
No other questions? Great. I just wanted to thank Dr. Keating-Power once again for being here today and for sticking with the system and helping be a change leader within the system itself. That's a big lift for you, and thank you so much.